Hi, my name is Cameron Druckenmiller, and this is my abdominal assessment for Health Assessment Lab. Currently, I'm just showing you my area so you know that and my patient, so you know that there's no lab book in sight and there's no cheating. So I'm just going to set up my camera, and right now we're going to ask for verbal consent from the patient to filming this video and being assessed in the abdomen area.
Yes, I do consent.
Okay, wonderful. So just a little disclaimer, normally the patient would be exposing her or his abdominal region, but for privacy purposes, we are going to leave the t-shirt on. So the first thing that we are going to do is inspect the abdomen. So we're going to look at the contour, looking at it if it's flat or scaphoid. We're also going to look at the general symmetry of the abdomen, making sure that there's no obvious bulges or enlarged organs that we can see. We're also looking hypothetically at the skin tone of the abdomen, making sure that it matches with the rest of the patient's skin tone, that there's no redness, pallor, cyanosis. We're also looking for any scars, tattoos, or piercings that we can note and document. Same thing with lesions, if there's any moles or nodules that we're looking at. So moving on, we are now looking at pulsations. Is there any visible movement that we can see with the aorta? Some patients, usually if they're skinnier, it is normal. However, if you can see violent, like bulging pulsations, that could be a AAA or an aortic aneurysm, so that should be taken care of. So next we're going to inspect the umbilicus. And we're going to know if it is protruding or if it's deeply sunken. Usually with obesity, the belly button is deeply sunken. So we're going to note that. We're also noting any hair distribution, if there's any abnormal distribution. Usually even females have some sort of thin hair layer on their stomach that we could note, usually light. And also we're checking the patient's overall demeanor. We want to make sure that the patient is comfortable. We're looking at their body, their posture, if they're holding themselves in a different way, that could signal us that they are in pain. So moving on from that, since we're doing the abdomen, we're going to jump into auscultation. So what we're going to do is we're going to listen for bowel sounds with the diaphragm, and we're going to listen in all four quadrants, starting in the right lower quadrant. Now, like said before, the patient's shirt would usually be up and I would be listening. However, privacy, we're going to leave the t-shirt on. So we're going to start in the right lower quadrant, and we're going to listen for 5 to 30 seconds and 5 minutes if we can't hear any bowel movement. Then you move up to the right upper quadrant. Once again, listen for 5 to 30 seconds. The left lower quadrant and the left upper quadrant. So usually if you can't hear those right away, you want to listen for at least 5 minutes to make sure that the bowel sounds aren't absent, as that could be an indication of an obstruction or an issue that needed to be handled. So next, we are going to be listening with the bell side of the stethoscope, and we're going to be listening for vascular sounds. And there's 7 spots, so we're going to start on the right side, it's the closest to me. And we're going to be listening for the femoral artery, the right femoral artery. And then listening for the right iliac artery. And then the right renal artery. Then we're going in the middle of the abdomen to listen to the aorta. Then we're moving over to the left side and repeating on the same arteries. So the renal artery, the left iliac artery, and also the left femoral artery. So here, what we're listening for is we're listening to see if we can hear any brewing or whooshing sounds, which could indicate narrowing of the artery or an obstruction once again. So after we have auscultated the patient's abdomen, we're moving on to percussion. So we're going to do percussion in all 4 abdomens, and we're looking for general tympany. Usually if you hear a dull note, that usually means there's some sort of distension or fecal matter. And if you hear a hyper-resonant note, there could be gas gas distension. So we're going to start again in the right lower abdomen, and we're just percussing. Okay, and we hear general tympany throughout. We're going to percuss the CVA after we palpate. So now we're going to move on to palpation, and we're going to start with a light palpation. So once again in the 4 quadrants, and here we're just seeing if our patient is grimacing or if they're in any pain. Are you in any pain? No. Here we're also looking for superficial masses or nodes as well. And then we're going to move on to deep palpation, which is with both of our hands. And here we're kind of looking, once again, for pain and masses, but we're also looking at the organ size as well. So we're going to start in the right lower quadrant again, and then move around in all 4 quadrants. And once again, we're looking at the patient's demeanor to see if they're grimacing or if they're flinching, to acknowledge any pain that they're feeling. So now we're going to look at organ size, and we're going to start with the liver. And normally the liver is only palpable 1 to 2 centimeters, but we're going to palpate anyway. And it is in the right upper quadrant. So I'm just going to feel around using both my hands. I'm going to have the patient inhale and go under and exhale. And I can slightly feel the liver, only 1 to 2 centimeters, but that is normal. Now we're going to move over to the left side, and we are going to palpate for the spleen. And normally the spleen is not palpable because of where it lies behind the stomach, but we try anyway. And we also can palpate for the renal system or the kidneys. So we're just going to lift the patient up and feel in the back and see if we can feel. Yep. And then we're going to do it on both sides, everything bilaterally. And we're feeling, seeing if it causes any pain, feeling for any enlargement or abnormalities. And then we're also going to palpate the aorta. And so we would just feel for the aorta, which should coincide with the apical pulse and the rest of the body. So now that we have palpated, we're going to move on to some specific signs to test for inflammation within the abdominal region. So the first one is the rebound tenderness sign, or the Bloomberg sign. And I'm just going to have the patient lay flat, and what we're testing here for is possible appendicitis. So I'm going to press down into the right lower quadrant, quickly remove my hand. Any pain? If she did feel pain, which she luckily did not, that could be a sign of inflammation in the appendix. I was touching my left side, I meant to touch my right side. So now we're going to move on to test for inflammation in the gallbladder, so cholestasis. So we're going to go up towards the liver, and I'm going to use deep palpation once again. And I'm going to have my patient inhale for me and go under and press in, exhale. Feel any pain or tenderness? No. Usually if the patient did feel pain or tenderness, that would be a sign of an inflamed gallbladder. The next sign that we are looking into is the iliopsoas sign. So I'm just going to have my patient lift up her right leg, and I'm going to put pressure, and I'm going to have her resist my pressing down. You feel any pain in your right lower abdomen? Wonderful. If the patient did feel the pain or burning sensation or had trouble resisting my pressure, that could be a sign of appendicitis. So now that we did that, we're going to move on to percussing for the CVA. So I'm just going to have my patient sit up and have her back, excuse the washing machine, have her back face the camera. So just swing your legs over here. And we're just looking to see, this test is to determine if the patient has any kidney disease or any inflammation like kidney stones or polynephrititis or things like that. So what we're going to do is we're just going to cup our hand over where the kidneys would lie, and then we just percuss. And if the patient is feeling no pain, good. That would be good. And we're going to do the same. And there is no pain there. And that concludes the abdominal assessment. Thank you so much for watching.